So we've set up the panel to take you from some of the excellent research that you just heard about into practical applications. And our next speaker is very well suited to talk about this. Dr. Charles A. Barrett is school psychologist at Loudoun County Public Schools, where he has been working since July of 2008. He is actively involved in the training and development of future psychologists and serves as an internship supervisor, as well as chairing the training program's Committee on Diversity. Additionally, he serves as adjunct faculty in the Department of Psychology at George Mason University and Northern Virginia Community College. To influence the manner in which school psychology is practiced, Charles has presented at various national conferences and has been featured in publications sponsored by state and national associations. His most recent publication, What About Me? School Psychologist and the Least of These, challenges school psychologists to serve all children and families, especially those who do not have a voice or who are unable or unsure of how to advocate for themselves. Charles graduated with honors from St. John's University with a Bachelor of Arts degree in Psychology and English. He later earned a Master of Education in Human Development and a Doctor of Philosophy in School Psychology from Lehigh University. Dr. Barrett?
Thank you, David. Good afternoon, everyone. Thank you for this opportunity to share with you. The panelists so far, Dr. Murphey, Dr. Friedman-Hill, certainly have laid some good foundation for me to speak about just how this looks at a regular school, public school in Virginia. So I work in Loudoun County, in a pocket of the county that primarily serves lower income Spanish-speaking students, 2 elementary schools, K through 5, a middle school, 6 to 8, and a high school. And for me, no day is the same as the previous day. A lot of fun, a lot of things go on. But working with boys in particular, I'm going to just highlight a couple of things that certainly stem from what was shared previously. The first thing is that although a lot of research has been done about boy behavior, how the brain develops, things along those lines, unfortunately, it doesn't translate to practice as nicely. So there is still this huge disconnect of those who serve boys, work with boys, families, not understanding these differences in brain development. And unfortunately, our expectations sometimes of boys might be inappropriate for their level developmentally. Where I come in, or how I'm involved in that, is typically through some kind of pre-referral intervention process, but also testing children for disabilities. It might be in your packets, but some work I've done over the years looks at the difference in perspective from assessors or raters, parents, teachers, how we interpret behavior, how that leads to differential outcomes for the students that we're serving. As Dr. Murphy shared before, certainly we have these different perceptions of boys, or black boys in particular, that oftentimes leads to disability or disorder versus diagnoses that at times are not the best answer if we knew some things or thought about developmental expectations and appropriateness differently. That's one thing that I think I see, or I know I see, working with boys in different public school settings, is that the expectations or the perspectives from those working with them oftentimes are not as appropriate as they should be. The second thing that I'll share is that, again, developmentally, the Congressman, I think it's Congressman Mullin, shared that there's no playbook, no rule book about how to parent and how to make these decisions. We kind of learn as we go along this process. But even 1 year sometimes can make a huge difference in a child's trajectory over their lifespan and educational success and outcomes. I've worked with boys, 2 in particular, that started school at an age that was appropriate, but they could have waited a year and started school a year later. So here they are now in class with boys who are sometimes 9, 10, 11 months older than they are, or girls, and we're comparing a child whose brain is still developing, the maturity level is not there, and they look more impacted than they really are. So sometimes the parent knowing well, I could keep the kid home for another year, give them some more time just to develop some maturity. It's not a matter of their cognitive potential, their cognitive abilities, but developmentally they're not ready for certain concepts. And the school, if they're not careful, could prematurely identify this child as being disabled or disordered. The young man I worked with a couple years ago, he was in second grade and was about a year younger than his peers. And in the classroom, he looked impacted, looked disabled, but if that same child was in first grade, which he could have been, but he started school early, there will be no problems, no concerns at all. It just depends on the reference group that we're at times comparing boys to. So I think knowing that, and of course, how do you know that early on before the kid now is in kindergarten or first grade having this difficulty? So I think this ecological model of people appreciating the contribution of medical factors, community factors, telling parents these things ahead of time, the prevention and rather than intervening is certainly very helpful. Unfortunately, I'm going to talk about something that happened in Loudoun this year, but it kind of frames the last thing that I'll say about boys in general is that mental health is clearly the next frontier for schools to tackle in a very deliberate way. I think we've done some things well in other areas. Prevention and academic skills I think we're pretty well on our way in those areas, but mental health is clearly the next frontier that we need to identify and really tackle. There were 4 suicides completed this year in Loudoun County, which is huge. We might get 1 a year, but there were 4 this year, 2 in February, and 3 out of the 4 completed suicides were males. These were older kids, they're not 6 to 10 or 6 to, but they were typically in high school. So the manner in which we start to respond to the mental health needs of boys in particular is going to be our next challenge as public school divisions. We can do things. Most kids that complete suicide do have some underlying mental health difficulty, typically depression or anxiety that has not been treated effectively. The school is in a great place to provide these kinds of support systems and services to mitigate those factors that should not end in a child taking his life. So just a couple things, I think, just to recap, the perspective that we have on boy behavior, be it teacher, parent, administrators, how that impacts their outcomes. Developmental maturity is huge for all kids, but especially boys, and the manner in which we can prevent some of the things by being more cognizant of that is going to be huge. And then again, mental health, a mental health focus for, again, all kids, but especially boys, is certainly our next big opportunity in public education. Thank you for your time.